everyone, my student number is U3252336 and I will be talking about ketoprofen. Ketoprofen is a non-steroidal anti-inflammatory drug or NSAID that is commonly used to relieve pain, reduce inflammation, and lower fever. It is designed for the short-term alleviation of slight discomforts and pain arising from conditions such as headache, muscle ache, arthritis, and the common cold. The medication class is known as propionic acid derivatives, which also includes drugs like ibuprofen and naproxen. The pharmacokinetics of ketoprofen can be influenced by certain formulations. For example, the presence of food in the stomach may slightly delay the absorption but does not significantly affect the overall bioavailability. It can be administered orally or topically in the form of gels or creams. This can provide localized pain relief with reduced systemic exposure and potential side effects. In its distribution, it is well absorbed after oral administration through the gastrointestinal tract, while the topical forms are absorbed through the skin. The peak plasma concentrations are typically reached within 1 to 2 hours and approximately 80 to 90% of oral bioavailability after oral administration. It has a high degree of binding to plasma proteins, primarily albumin, which can affect its distributions and interactions with other drugs that are also bound to albumin. Approximately 99% of the drug is bound to plasma proteins. Ketoprofen undergoes hepatic metabolism primarily carried in the liver. Its primary metabolic pathway involves conversion of the drug into several metabolites through oxidation and conjugation reactions with glucuronic acid to form inactive metabolites. Furthermore, it is not extensively metabolized by the cytochrome P450 enzyme system. After undergoing metabolism in the liver, the resulting metabolites goes to both glomerular filtration and active tubular secretion in the kidneys where it excreted via urine and bile. The elimination half-life takes about 2 hours for half of the drug to be cleared from the body. For special populations have prolonged half-life due to reduced kidney function and slower drug clearance to prevent the accumulation of the drug. However, it can vary among individuals. The pharmacodynamics of ketoprofen is a non-selective inhibitor of cyclooxygenase enzymes, specifically COX-1 and COX-2. COX-1 is involved in normal physiological functions including stomach lining protection, while COX-2 is induced during inflammation. By inhibiting cyclooxygenase enzymes, it plays a key role in conversion of arachidonic acid into prostaglandins, which are signaling molecules to mediate inflammation, pain relief, and reduction of fever. By reducing their production, ketoprofen helps alleviate pain associated with various conditions including musculoskeletal injuries and inflammatory disorders. The overall efficacy of ketoprofen is best evaluated in consultation with a healthcare professional who can consider individual health factors and tailor the treatment plan accordingly. Physiological effects of ketoprofen can interact with other medications that affect the same metabolic pathways or protein binding sites. Also, a risk of gastrointestinal side where it leads to vasoconstriction and platelet aggregation that would cause such as ulcers and bleeding. Ketoprofen can cause changes in renal function by affecting the blood flow to the kidneys which may cause edema, and also it may increase the risk of bronchospasms to patients with asthma by affecting the prostaglandin synthesis. An interdisciplinary team according to the PBS of therapeutic goods, ketoprofen is under Schedule 3 if it's topical or containing 25 mg or less per dosage, and Schedule 4 prescription if it's higher than 25 mg. The prescribers consist of dental practitioners, medical practitioners, and nurse practitioners. Counseling. When utilizing ketoprofen in adults, it is recommended to administer it orally through a 200 mg tablet once daily following a meal or with milk if stomach upset arises. It should be ingested whole and patients should be cautioned against crushing, chewing, breaking, or opening the tablet. Additionally, it is advised to store the medication at room temperature, keeping it tightly closed when not in use. A noteworthy side effects may include nausea, dyspepsia, bleeding, elevated liver enzymes, diarrhea, headache, dizziness, salt and fluid retention, and hypertension. In the end of an allergic reaction post medication, patients should promptly seek medical attention if unusual symptoms manifest. Furthermore, emphasizing the significance of follow up appointments with healthcare providers is essential for monitoring treatment response, assessing side effects, and making any necessary adjustments to the care plan. Thank you.